Okay, hi everybody. It's Tanya Schultz. It's my weekly short health spaces with Dr. Kumar. He'll be joining in. We are live right now on YouTube, Facebook, Twitch, Twitter. So again, oh, there's Dr. Kumar. There we go. Hi, Dr. Kumar. I send you the co-host invite. You might have to update your app if there was an update also. There we go. Good afternoon. How are you? I'm going to pin on the nest the article that we're going to talk about, testosterone therapy and men's health.
Hello?
Hi. I think I accidentally sent. Oh, I sent it to. I wanted Carlos to come in here because he was tweeting about men's health, and we talk a lot about this. So, how are you? How's your week?
Doing really well. Thank you. Anybody else on the call? Tanya?
No, not yet. No,
Not yet?
not yet. Again, I told everybody this is a short health spaces. I'm trying to finish
Yeah.
publishing all our other spaces because I'm making all this
Cool.
into a blog.
Yeah. Yeah.
And testosterone therapy is it used to be very controversial, not accepted pretty much for men, for men's health. And so today, I know that a lot of men are looking for this type of information, and it's such a big difference compared to 10 years ago. Dr. Kumar, why don't you tell us a little bit about yourself, and let's talk about testosterone therapy.
Absolutely. Hey, thanks.
Hi, Carlos. We just lost you, Dr. Kumar.
Hi, Tonya. Hi, Ramesh. Is it Ramesh or Ramesh?
I got Ramesh, but I call him Dr. Kumar.
Dr. Kumar. Okay. I'm guiding for what I'm
Okay, how about
seeing
now?
in the
You
screen.
okay?
Yeah.
Okay, you're perfect now.
Can you guys hear me?
Yeah, perfect. And I'm
Yes.
starting following you. I was not following you yet. So it's Ramesh, right? Ramesh Kumar or Kumar.
He's I think he's going to his office, so he's
Okay.
driving.
No, because I'm very careful. I do take a lot of care with the proper pronunciation. I want to know always what's the proper pronunciation that people want for their names. I think that was the oldest trick of public relations I learned like 45 years ago when I read Dale Carnegie's How to Win Friends and Influence People. And he devotes like 12 pages to the importance of the other people's name. And it has been totally true. I mean, it's part of human nature where every person.
I actually own a book from that was published. It's such an old book, actually. I own the book, and then I actually own a DVD.
Oh, okay.
I think I got.
How to win friends and influence people.
Yeah, I read, and I'm sure Dr. Kumar read it too. Can you hear us now, Dr. Kumar? How are you?
I can hear you. Can you guys hear me?
Yes, totally perfect.
Yes.
Oh, Perfect.
So let's
All
talk
right.
about
So
testosterone
here,
therapy, the importance of for men's health.
yeah. So the thing is this. So testosterone therapy is one of the most misunderstood topics in when it comes to men's health. Okay. So I was like any other physician till about 4 or 5 years ago. I'm a radiation oncologist in my background, but then I started thinking about how to best serve my cancer survivors. So that's how I ended up in trying to figure out solutions for all these issues that has a major impact on the quality of life on my cancer patients who have survived, the cancer, and now they need to get on with their life. So one of the biggest topics that I found that really helps a lot of folks is trying to get rid of these myths around testosterone therapy. So the biggest advocate for testosterone, um, in my opinion, is Dr. Morgan Taylor, Morgantaler. He's a urologist at Harvard Medical School, and he's the go-to person who really puts everything straight. Now, obviously, everybody who's listening, who's on this call, need to make their own decisions. Make sure you get the right information before you start, taking on testosterone therapy. So, having said that, we look at testosterone mainly as a sex hormone. Now, yes, it does help with the sexual function and all that, but much more than that, what we need to realize is testosterone is an essential hormone for so many other things. Like, for example, mental health issues, we need testosterone. For cardiac issues, to prevent heart attacks, we need testosterone in our body. To actually prevent prostate cancer, we need testosterone in our body. For gut health, for uh, musculoskeletal health, you name it, we need testosterone therapy. So when we have testosterone deficiency, it can show up in multiple ways. Number one is obesity. The second is inability to lose weight. Number three would be mental health issues. Number four could be sexual issues, erectile dysfunction, and so on and so forth. So the problem is that most patients are scared to death by their physicians, and one of the first few things that they're told is, number one, that testosterone therapy in men is going to lead to increased risk of heart attack. Okay, that's a freaking myth. That's the first thing that we need to eliminate. In fact, there's tons of studies that showed that testosterone therapy actually prevents heart attacks in men. So if you look at the data from Dr. Morgan Taylor, he's got tons of information on that particular topic. So in my opinion, every cardiologist who is managing patients who have survived heart attacks should be looking at their testosterone levels and be doing something about it. But that's not what's happening. So that's one example. So second thing is, folks are told that they are at high risk to develop blood clots and pulmonary embolism and death because of high testosterone levels. And the way they justify it is by saying that testosterone will actually make your blood thicker. So what do they actually mean? So testosterone is necessary to stimulate the bone marrow to produce more red cells. And the way we measure it in our when you do a lab work is what's called the hematocrit value, HCT. Generally, most of us are in the range of 41 to about 45. Hematocrit. Now,
Dr. Kimo, you're
obviously,
kind of
I
breaking up
do
right there.
believe that. Did I break up?
Just for a second, you're good now.
Okay. So testosterone therapy increases the red cells. And if you monitor it right, I do not let the hematocrit level go beyond 51. Okay. And you get enough therapeutic benefits with a hematocrit target of less than 51. Now, where does this stuff come from? So because testosterone increases our red cells, they think that because of increased viscosity, that will cause the blood to clot. Now, the counter to that is, if anybody lives in high altitudes like Colorado, you have a hematocrit level of above 51 because of the lower oxygen pressure at that height. So you don't find a whole bunch of folks who live in Denver killing out with a heart attack or a stroke or a pulmonary embolism, because it's a physiological reaction of the body to increase hematocrit level. Okay, so unless it goes way beyond that, that's when I would worry about blood clots. But the bottom line is that is a myth, and that is something that people need to kind of be aware of. Do your research. So all these things are based on information that we got over 20, 30 years ago. And in medical school and in our training, we've been kind of brainwashed into believing these kind of myths. The third myth that exists when it comes to testosterone therapy is that there is a chance that testosterone can actually cause prostate cancer, and number two, can aggravate prostate cancer in those who have actual prostate cancer. Now, when you look at the data from Dr. Morgan Taylor actually believes that one of the therapies for those who have widespread prostate cancer is actually testosterone therapy. Improves quality of life, may not have an impact in survival, but the bottom line is, and again, this is the way I was brought up too. Anybody with prostate cancer, testosterone therapy is an absolute no-no. It's in fact close to malpractice. But with the data that we have available, testosterone levels or increase in testosterone levels using testosterone replacement therapy has very little impact or no impact on the risk of prostate cancer. And there's a very simple way of understanding this. Most prostate cancers occur in older men, past the age of 70. Now, where do we find the lowest testosterone levels? It's in those who are over 70. So there's actually an opposite correlation between testosterone levels and the risk of prostate cancer. The lower the testosterone levels, the higher the risk of prostate cancer, right? It just makes sense. You don't, very rare to see prostate cancers in somebody, who's in their 40s and 50s when the testosterone levels are pretty high. So these are some of the things that we really need to be aware of, because in my practice, again, it's very nuanced. You just can't go blindly jump in and say, oh, I need testosterone and just go on with life. No, that's not true. It's a very nuanced approach, but it's a very safe approach to improve the overall quality of life across all men over the age of 40 or 50. We start reducing our testosterone levels past the age of 40, about 10% a year. Okay, I mean, that's huge. And that's what ends up in so many medical issues that we see, as we get older. For example, heart attacks, myocardial infarctions, and strokes, and so on and so forth. So we got to consider testosterone therapy as fundamental to the health and well-being of all men across the board after the age of 40 or 50. So that should be the take-home message. But again, there are so many people out there who do not have an understanding of the role of testosterone levels and how important they are. And so one of the simplest ways of monitoring testosterone is to do the labs at about 10 o'clock in the morning and take a look at that. So again, let me caution people on how to interpret those labs. So all labs will give us a range. We have the bottom level of the range and we have the top level of the range. Now, at the bottom level of the range, so let's say I'm just going to throw some random numbers just to illustrate a point. Let's say the lower end of the range is 250 for total testosterone, and the higher level of the range is, let's say, 900. So now, if the level is 251 and you are quote unquote within range, people are turned away. Hey, listen, you have a normal range, so that's it. You just go home. That's it. You're done. You don't need any supplementation. Now, those lab numbers, those ranges come from population studies. It doesn't come from each individual person. Okay, so especially when you have symptoms, my thinking is to raise the testosterone level to at least the mid-range or to the higher end of the range. There's no reason to go beyond the upper end of the range unless you really know what you're doing. and in the conditions that we have to kind of be careful about. So there's a lot of myths surrounding the interpretation of testosterone levels, and the other mistake that people do is when they're monitoring testosterone levels. Let's say somebody gets on testosterone therapy and they're monitoring them. They're just monitoring too many variables, and people kind of get lost and do not know which way to go. Do we need to reduce the testosterone levels because of this number, or do we increase it because of this number? The simplest way to handle testosterone levels is to use hematocrit as a guide. And the other mistake that I've seen people do is put them on testosterone levels, put the men on testosterone levels, and then throw an anti-testosterone medicine onto it. And I see this so commonly. Patients are placed on testosterone therapy, and some of them do have hair loss. And what happens? So they are given finasteride. Now, finasteride is a testosterone blocker. So on one side, you're giving them testosterone, and the other side, you're giving them a testosterone blocker. Now, make up your damn mind. What do you want to do? Do you want to reduce the testosterone level, or keep it active, or what? So there's so much of confusion that's going on in the traditional medical area, that I would urge every one of the persons who are listening to this call to be really, really careful. Talk to somebody who has some good training in hormone replacement therapy. Unfortunately, most of the training that people get is very confusing. So my go-to person for all the education that I've had in the hormone replacement therapy area is Dr. Rozier, Rozier. He's out of Salt Lake City, Utah, but he has a practice in California. He's one of the best authorities on there when it comes to hormone replacement therapy in men and women. I think this is something that I've been wanting to spread the message about testosterone therapy, and again, if you're live and breathing, and if you're over the age of 50, I think your quality of life will just skyrocket if you just look at your testosterone levels, know how to interpret that, know what kind of intervention to do, and know how to monitor it going forward. So with that,
Dr.
I'll stop. And if there are any questions, I'm happy to take them.
Yeah, Dr. Kumar, yes, I would like to explain you my situation because it affects me quite directly. First of all, my father, my late father, he was, they detected like 30 years ago prostate cancer in him. He got an early operation. So he actually lived 15 more years until he's 85 years old. He died in 2006, and he had a pretty good quality of life and got on until the cancer did spread to the soft tissues in his abdomen. So, like in 3 months, he was gone. So,
Yeah.
I am his son, directly his son, and I am 60 years old now, and so I am, of course, worried because I know I've heard. And I want to know that I've heard a lot of that prostate cancer is very, very hereditary. I mean, you can receive it from your parents or from your parent. In this case, from your father. And the other thing is that I am actually a patient also of DVT. I got DVT, a deep venous thrombosis in my popliteal vein, like 16 months ago. I have been treating with rivaroxaban and flevofmin. By the way, I have been having medicines coming from India, particularly here, because I am in Venezuela, in South America. So it's quite a trip quite a trip for the medicines for going
oh my lord. I've been to Venezuela like 15 years ago.
Oh, great. Did
Margarita Island.
Caracas? Margarita Island.
Margarita Island. Yeah.
Margarita Island. Okay. That's beautiful. Amazing. That's really beautiful. So what I wanted to ask is a particular question. I mean, I have a background as a comedian too, but I am a real journalist. I have a real journalist, like for serious issues. And I don't want to, I want to make a question that could sound like a light or
Sure, no worries. Go ahead.
but it's something that I want to be clear about it. I
Yep.
have read the last 3 years, 4 years, that they have been discovering a strong relationship between masturbation, in the case of males, with the very, very lower risk of prostate cancer. Of course, I do my antigen yearly. In my
Yeah,
case,
PSA.
I
Yeah,
try to make it. Yeah, exactly, the PSA. I try to do it like twice a year if I can, and the
yeah,
levels have been under control. And
no,
the tactum rectal tactum has been great. The results, the doctor told me that the prostate is very, very small
yeah,
until now, because I'm 60 already. But
yeah.
is that true? That relationship about the masturbation and the in this case, I think is the frequent ejaculations. There is some relation among that and a lesser
As
at
far
a
as
lesser level.
as far as I know, I'm not aware. It's not something that we bring up. It's not something that I've even looked at, but I'll be happy to take a look at it once more from an
Hey,
academic
but
point.
I think even in Lancet, I think that there was something published even in Lancet, the British
Yeah.
journal. So if you haven't heard about it, I mean, I will invite you to.
Yeah, I will. I will.
I,
I'll take a look at it because my focus is, again, that's like a behavioral issue. So I'm not sure how to kind of even
yeah,
interpret
yeah,
that.
I understand.
From yeah, it's more of a lifestyle issue, I guess. I mean, I don't think I can make a medical recommendation for men to masturbate frequently. I don't
Yeah,
know.
yeah, exactly. Yeah, just like a
That's a
recipe,
little bit too delicate for
a
me.
recipe or something like that. And the other and my other question fast is, we're talking about testosterone therapy. How
Yes.
is it administered? I mean, is it like pills?
So here,
Is it
that's a
like
great
injection?
question. Listen,
Yeah.
the easiest thing to do is to apply a cream. Okay. Now, there are different compounding pharmacies that I use, and I have my own unique method. But, the reason we use the cream twice a day onto the skin is because we want to maintain a steady state level. Okay. Now,
Okay.
okay. So, steady state level. The problem with injections, unless you get a daily injection or a weekly injection, or if you use what are called pellets, the problem with that is the levels are not as steady as we want them to be. So you have these dips, and the levels increase and then they decrease. So I can determine whatever level I want it to be based on the timing of my blood draw. Okay.
Okay.
If I
Okay.
draw the blood just at the tail end, let's say it's a 3-month pellet that I've inserted. Okay. So if I do the blood work and check the testosterone levels, 3 days before it kind of wears out, then I'm really going to get low levels. Right.
Okay.
So, or if you do it at the peak, at the mid range between the two sessions, then you're going to be super high. Now, so what's the truth? So where should we be? Because now we have a moving target. Now, the beauty about using testosterone creams is because you get a fairly steady state. So, I mean, I generally check the testosterone levels about 3 weeks out. And I
Okay.
know if the level is too high, I can tweak it back, because I'm applying the cream twice a day. So it's easy for us to kind of manipulate the dose fairly quickly, either up or down.
And that could help me in the case of my vein obstruction, because my obstruction was detected with a Doppler echosonogram
Yeah.
1 year, 14 months ago, and the level of obstruction was very heavy because the vein was obstructed in 98%.
Yeah.
But now, thank God, it's already 9% only. I'm still taking rivaroxaban. So in my case, this testosterone therapy could help anyhow.
I would start with your testosterone level right now. Okay. Find out what your testosterone levels are. Okay. If they're
Okay.
leave you alone. You understand? But
Okay.
if you have symptoms related to low testosterone levels, okay, low
Okay.
testosterone levels, then you have to make a decision as to how we want to tweak it, because now you have the risk of a DVT plus all the devastating effects of low testosterone levels. So now that
Mhm.
judgment call. So let's say your testosterone levels are adequate and you're functioning fairly well. Hey, you don't need replacement. You got it?
Yes, I get it.
Okay. So
Exactly.
some of the simplest things that we can do naturally to restore our testosterone levels is to get adequate sleep, enough
Oh my
exercise,
goodness.
enough exercise.
I'm
Again, all
canceling.
these
I'm canceling. I'm canceling Netflix.
yeah. So
I will. Yeah.
when you adapt these lifestyle changes, yes, it's not a dramatic change. And also be aware there are a lot of medications out there that reduce your testosterone levels. Okay. One of the
Okay.
biggest are SSRIs, mental health medications. Okay. The ones that are used for hair loss, like finasteride, dutasteride, they also have a tendency to kind of mess up testosterone levels. So be cognizant because there's so many variables in that determine testosterone levels. So make sure, so go through your detailed history that you're taking, the medicines that you're taking, and make sure that you're taking the right stuff and not the wrong stuff that may have an impact on your testosterone levels. So it's
Okay.
not as simple as it sounds, but it's something that I want people to be aware and take action. Okay, don't sit back. Even if you have a PE, even if you have a DVT, take a look at it and make a judgment call. You see?
Yeah, I had to do a Doppler the next week, so I will
Yeah.
ask the surgeon about this. And also, there is any kind of symptoms, just like headaches, balance, loss of balance, or something. What are the main symptoms? If you want to repeat them,
Uh,
if
uh,
you can,
so symptoms of what? Of low
yeah,
testosterone?
the symptom of of having an not adequate testosterone
Okay.
level.
So no, this is a long-term issues. Okay, it's not a short-term issue. So basically, low testosterone levels would occur.
Hmm.
So it can manifest as erectile dysfunction. Okay, sexual function goes down, libido goes
Okay.
down. Okay, and people start putting on belly fat. So one of the symptoms is
Hmm.
of low testosterone is somebody who's got central fat. Okay, huge amounts of fat, and they can't get rid of whether with diet or exercise. It just stays there. um, or somebody who's had high cholesterol levels, heart disease, somebody who's had vascular disease. So those are the things that we need to look at as being symptomatic of low testosterone levels. So there's a whole syndrome of what's called hypogonadism in men. So if you guys Google that, you'll pop out all the symptoms that are related to hypogonadism. So it could be depression, it could be mental health issues. There's so many things. It's across the board, and loss of musculoskeletal structure. People start feeling weak. Whatever they were able to work out, they're not able to do anymore. So there's a whole host of things that we need to be aware of. So again, you
Wow.
need somebody. So the reason that I'm making these calls is to bring awareness. It's very difficult for me to make a recommendation, on a group call like this, but at least it'll give you guys enough room to ask the right questions and make sure that whatever decision you're going to make it with your eyes wide open, not because of
Exactly.
or anything else, but hey, if I do this, this is going to happen. If I do that, that's going to happen. So what do I want to live with? See,
And
uh,
of course,
the, the
I
focus.
guess the
Yeah.
the age factor, of
Yes.
course, is, as you
Yes.
said, prostate cancer is more prone to in older
Yeah.
persons. Like,
Yeah.
how what's the age that some people, some men will need to start checking that, starting 40 years old, 45,
If 50 or 60, again, it depends on who you're listening to. So the PSA levels used to start at the age of 40. Then they said, oh no,
40 exactly.
we are checking too many PSA levels, a lot of false positives. They're getting treated unnecessarily, biopsied unnecessarily. So it depends on the risk. So I make an individual assessment of each patient, based on the family history, based on their personal issues, and so on and so forth. So, I mean, I have my own guidelines on how I detect and start worrying about prostate cancer in men.
And what about diet? Is there any special food that can help?
Unfortunately, all we say is eat well, eat healthy. I mean, that goes across the board. But what does that mean? I think that's a topic for another day. We can talk about intermittent fasting. We can talk about all these diet things that are around. But I mean, the simple answer to that is, what works for me is intermittent fasting.
Okay, good to know that.
That
Okay.
for me. And so that's it. I mean, it's the best that we can do. And I'm 62 right now, and I've never felt better in my life. I mean, level of physical health, mental health, sexual health is off the charts right now, and I'm on testosterone.
Okay, okay, good to know.
Yeah.
And the good sleep is important, but with the scrolling and the social media and the and the Netflix and the HBO Max and stuff. I mean, and even the other day I went to bed like at 4 a.m. You know why? Because I mean it was India's fault because I
Oh
was
yeah.
watching. You know why? Because I was watching Three Idiots. I love that movie,
Oh my God. Yeah,
and
I
I
love
was
that movie.
rewatching Three Idiots again, and I said,
Amir
"Oh
Khan.
my goodness, it's 4 a.m. I have to go to sleep." So
Yeah.
I finished watching the movie, and then I went to sleep very, very late.
Yeah.
So that's what I'm joking and telling you was for India's fault. But
Yes.
that movie is great. I love the message of "All is well" when they
Yeah.
sing that song,
Amir Khan.
touching
Amir
the
Khan.
heart.
Yeah.
Oh, exactly. All is well. All is well. That has helped me a lot. Very, very good
I love you,
message.
Carlos. But you know
Okay.
what? It's 2:01.
I've
I
got to
want to
go.
get Fernando. He wanted to ask the question, and then a good friend, Dr. Simi, is here too. So, Fernando, did you have a question? Fernando, chaos.
Chaos. Ah, okay. I see chaos.
Listen, Tanya, have them message me if they have any questions. I've got a couple of patients waiting.
Oh, okay. Well, let's say hi to Dr.
Okay,
Sim,
run.
and then so we can say goodbye to you. Hi, Dr. Sim.
Hi, Tanya. I just thought I would jump in and say hi to you and Dr. Ramesh. And
Oh, thank
well
you.
done.
Okay, guys have to
You're
run.
welcome. All right, y'all run
Okay,
too.
thank you,
We'll
everybody.
we'll catch up next week. That was
We'll
fun.
catch up next week.
All
Okay,
right.
everybody, have a great day. We'll be back next week at 1:30. And like I said, this is a short health spaces. Thank you, Carlos, for co-hosting. And Fernando, I'll talk to you later. And thank you, Gino, for being here. Bye, everybody.